So I am a wraparound facilitator with Sandra Eskenazi. I love that I can be flexible enough to meet families where they're at. Change is possible, that people can change. We don't have to be labeled and stigmatized and be stuck with that.
I'm a school-based care coordinator for the Sandra Eskenazi Mental Health Center. I currently see clients in the school community, sometimes in the home during breaks, like summer break or fall break.
My role here at Sandra Eskenazi is I am a clinician. I'm with the Children's Outpatient Department, so I am the clinical mental health therapist.
I'm a care coordinator for Sandra Eskenazi Mental Health Center. I work in the Children's Outpatient. I teach behavior management and emotion management skills to children, as well as offer parent support sessions.
I love working with kids. I love getting to know the kids. And I kind of am able to let out my own creative, kind of kid-like side with the children and just being creative with it, having fun with them.
Some of my favorite things about my work is how different it is every single day. Every time I walk into my office, I never know what it is that I'm going to get during the day. I love getting to be able to work with kids, getting to see how much they grow and change from the point in time that they start seeing me to the very point in time that we actually end services.
It's been meaningful to see my patients be able to feel happier, improve their mood, implement some of the things that they're learning here in their daily life, and then feel like more confident in managing their life stressors.
I think that there's a lot of stigma, especially with children, because adults will see children who show bad behavior as just a bad kid, which is how the children feel as well. They think that they're a bad person because they make mistakes. But kind of reiterating that there is similarities between having a physical illness and having a mental illness, that mental illnesses are just as important and prevalent as physical illnesses, and they should be taken just as seriously. And so trying to help the child understand that even if they do have a mental illness, it's not an excuse for their behaviors, and helping them understand and empowering them through confidence and positive thinking that they are able to overcome their mental illnesses.
Something I always share with parents and kids is that I am not a fairy godmother. I don't have a magic wand. It's not going to get better within, 2 weeks or 2 months. Sometimes it takes quite a while in order to see change and progress, but if they are willing to work with me and stick with me through the tough times and put in the work and the effort, then they will see that change and they will see that progress.
Treatment to me means that even if you're going through hard times, you can get the help that you need in order to feel better. It also means that even if when things get overwhelming, you have somebody you can go to and they'll teach you the tools in order to help you help yourself.
I definitely, looking back, it's countless how many families would have benefited from these services, these preemptive services that they can strengthen and help families avoid any kind of struggle or overcome any struggle they come across.
There is hope. It may not seem like it now, but even finding the tiniest little bit of thing to hope for, that's what matters.